of nails. This is very interesting phenomenon in duration of psoriasis. You can find involvement of nails, and involvement of nails, process of involvement of nails, nearly in 10% may be initial clinical signs of this disease. Only involvement of nails. And you can find the elements, dystrophy of the nails, pitting on the surface of the nails, and that's why it's very interesting clinical symptom of this disease, because very often misdiagnosed, such as fungal disease or tinea inguinum, and you know about this possibility, but your patient with involvement of nails in process needs in additional laboratory investigation for the confirmation of the right diagnosis, such as in situation it may be psoriasis. Next, involvement of nails, don't forget about this possibility, and that your patient needs in laboratory investigation. You can find involvement of nails not only on the feet but on the manum. You can see specific change of the nail in the patient with psoriasis. You can see the psoriasis elements such as formation of purple, formation of the scarring on the surface. This disease is dry disease as a rule. But sometimes may be prevalence of exudative component, and that's why possible formation of exudative form of psoriasis. And the name of this exudative form of psoriasis is pustular form of psoriasis, pustular form of psoriasis, because you can find multiple pustles, such as clinical symptoms of this disease, but the inner structure of this pustle is sterile. They are not staphylococcal or streptococcal genesis, and this is interesting moment, and formation of this element is in direct relation with prevalence of exudative process of inflammation, exudative component of the process of inflammation. This form is very rare, but you must be informed that we know exudative form of psoriasis. It's very rare form, but you must be informed about this. Next moment is this. You can see this process of formation of psoriatic plaque on the manum. You can see this redness of the skin, scarring on the skin. This form is dry form because eczema is characterized by possible formation of multiple vesicles. You know about this. And in this situation you can find dry form, dry disease, such as formation of purple and scarring on the surface. The next step in our presentation, this involvement of joints in process, because psoriasis is characterized by possible involvement of process connective tissue, and that's why possible formation of problems in kidneys and problems in joints, because sometimes maybe insufficiency of kidneys and maybe involvement of joints, small joints as a rule. And you can find at the beginning the process of movement of joints, and you can see that more later destruction of this element and deformation of the joints. The first step, next steps the same, formation of the deformation of this element, and the last is immovement of the joints, and this very serious complication of this disease, and you must be informed about this serious complication of this disease, because you must imagine what problems may be at the later stage of this disease. Now about the moments of the histopathology of this disease. What histopathological change you can find? The theory of the formation of this disease, we can divide into the two principally important groups. The first is infection genesis of this disease and infected theory of the formation of this disease. And about the infection, it's very important role belongs to streptococcal genesis of formation of this disease, because very often involvement of the amygdalin in process and the process of tonsillitis, streptococcal genesis may be as a factor of formation of this disease, because the operation of tonsillectomy very often is very helpful in the treatment of this disease. But it may be or may not be this effect. About probably may be effect. About the infected, non-infected, the predominance is the genetic predisposition, because it is postulated that we know the gene which is responsible for the formation of this disease. And the possible formation in the formation of this disease in children, if both parents have this disease, nearly 70–80%, this percentage is very higher possibility, or if only one from the parents has this disease, we wait formation of this disease in nearly 30–40%. And this is very important. That's why we must conclude that this disease is phenotypic presentation of genotype of the patient. Phenotypic presentation of the skin, the genotype of the patient. And that's why you understand that the method of treatment has action on the genotype of the patient, and that's why the method of gene engineering is very important in our diseases, because by this way we can act on the duration of different diseases, such allergic diseases, such as psoriasis, and a few others. And about this moment, and the genetic predisposition is the fundamental moment in the formation of this disease. Pathogenesis. Pathogenesis is the activation of process of mitosis. Very often the initial of this initiation of this disease is in direct relation with nervous stress. Why? Because the increased level of adrenaline and noradrenaline in the situation of stress acts on the process of mitosis, and by the way of activation of mitosis, we wait the formation of these elements. But the patient must be genetically predisposed to the formation of this disease. He or she must be genetically predisposed to the formation of this disease. And then, not only nervous stress, but using of antibiotics. Why we are we explain to our doctors that they must be very careful in the indication of antibiotics, because formation of fungal disease, and in genetically predisposition patients, formation of psoriasis, and because English scientists name the using of antibiotics, such as the opening of the door for the formation of this disease. And that's why don't forget the antibiotics may be as a factor of phenotypic presentation of this disease, but genetically predisposition in the patients. Next, viral genesis. About the viral genesis, it's very little information, because you can find the viral particles in the cells, and under the nervous stress, activation of these viral particles and the formation of this disease. And the very important, the investigation which had been done in United States, when from the 40 patients with psoriasis, the blood was transfused to the 40 volunteers, and it's impossible to find any clinical case of the formation of psoriasis. That's why the scientists conclude that the way of the horizontal way of the transmission of this disease is absent. Only vertical way or genetical predisposition to the formation of this disease. That's why activation of process of mitosis, and you can find the elongation of the structures of the skin, and the name of this, the process of elongation is acanthosis. You can find the process of acanthosis. Next. Possible involvement of bacterial flora in process. The evidence, confirmation of this possible involvement is the formation of microabscessus of Potrier. The name is microabscessus of Potrier, which this microabscessus is consisted of the neutrophils, and neutrophils use the factor of the, you know, that's the factor of antibacterial resistance. And the very important moment is why this element is red. Because you know about the activation of the process of mitosis. Activation of this process needs in oxygens, and you can, and the presentation and the presentation of the oxygen to this affected area across the blood. And that's why you can find the dilatation of blood vessels, because you can find the deposit of the blood and increased level of oxygen in this area. That's why this element is red in progressive stage, and you can find this element is pale later, because the skin is not need in this situation, need not in the oxygen, and that's why you can find the change in the color of this element in the duration of this disease. Now, if you know this method of pathogenesis, it's more easy to present you the information about the method of treatment of patients. As a rule, what kind of medicines can you use in the treatment of this patient? The first is medicines which are characterized by antimitotic activity. But the name is methotrexate and so on, but don't forget that in the process, that in the organism, you can find the process not only mitosis, but process of meiosis. And in a situation of meiosis, this medicine acts not only on mitosis, but in meiosis too. And that's why the using of these medicines in the age up to 65 years is not helpful, is not useful, and we can conclude is contraindicated as is possible, because you must prevent of using of this medicine in this age of patient. But you can use the similar activity medicines such as vitamin B12 or cyanocobalamin or folic acid. You can use the vitamin A, retinol acetate, and if you register the itching, you can use antihistamine medicine. The name of this method of treatment, Hungarian method of treatment, is very effective in treatment of patients. About the using of the medicines, corticosteroids. Corticosteroids ointment, but don't forget that the penetration is very easy, and you know about the adverse effect of this medicine. About the other possible medicines from our clinical practice, they are not so effective such as corticosteroid ointment, because we had a lot of experience of using of other forms of medicines, but the effect is not so prominent, such as in using of corticosteroid ointment. And very important, the physiotherapy method. About the physiotherapy method or UVA therapy, psoralen is a factor, substance of the increase of the sensitivity of skin to ultraviolet UV, and A is the length of the wave in this situation. That's why name PUVA. This method is effective, but sometimes may be very serious complication of this method, because in irrational methods of treatment, possible formation of cancer of the skin. And then the psoriasis is a medicine which patient must taken by the parents, and may act on the liver and formation of the serious complication from the liver. That's why we avoid of using of PUVA method, because it's sometimes very often, not sometimes, but very often this severe complication in irrational regime of using of this medicine. About the spa method. Spa method is Dead Sea in Israel, is very effective method of treatment, very effective method. In Georgia, we have a few spas such as Ureki, because this area is microclimate. It's very effective in the treatment of this disease. Nunisi is very effective in the treatment, but it isn't complete method of treatment of patients. In Israel, in Georgia, I'm sure in your countries, isn't complete method of treatment, because this disease is unfortunately a genetic predisposition, and we wait exacerbation of this disease after the nervous stress, using of antibiotics and so on. And don't forget that the method of treatment is very difficult in this situation. And contact with patients of psoriasis is very difficult, because it's sometimes the change in the mental behavior of this patient. It's very difficult to find contact with them, and that's why we are very, our contact with patients is very without the smile, without the other additional characters in the contact with patients, because don't forget there's this problem in the mental situation of your patient. This is information about the psoriasis, and next lecture is around the syphilis, because